Alright, so for the next issue which we'll discuss, this is what is known as a hyperreactio Luteinalis. Okay, so if you look at this word hyperreactio, it's like hyperreaction. Okay, Luteinalis, which what actually looks in the body like Luteinalis, I would actually say luteinizing hormone. Okay, so let's just describe what it actually means. You could see a lot of images to aid us understand. So it's just an ovarian condition. All right, so it's characterized by what? Bilateral ovarian enlargement. That means what? The ovaries are actually getting so large, and it's usually bilateral. That's like on two sides. Okay, so this is because you have multiple luteinized follicle cysts. Let's go on. All right, so it's typically associated with elevated levels of human chorionic gonadotropin. Yeah, all right. So I was thinking luteinizing hormone, but it's actually human chorionic gonadotropin. So I know these things, but I actually make these mistakes purposely. Now this is because it will now end up like a joke, and you will never forget it. Okay, so it often occurs most often during pregnancy. If the person has issues like gestational trophoblastic disease, multiple gestations, like it's not one child, you have twins, triplets, fetal hydrops, ovulation induction treatment. Maybe they are giving you some drugs to actually induce you to actually release an egg. Okay, clomiphene, follicle stimulating hormone, and also the human chorionic gonadotropin can be given to you. Do you understand? So the ovaries are actually getting so large. All right, so clinical features is the person is having abdominal pain or pelvic pain, ovarian torsion, virilization. All right, sometimes if androgen production, that's like testosterone, is now so high in issues like this, the person can now be having some features of males. That's what virilization. Then if they do ultrasound, they show that the ovaries are actually so large and it's filled up with cysts, looking like a polycystic ovarian syndrome, but not it. Okay, so causes and association is is primarily due to human chorionic gonadotropin levels getting so high. So this can be seen in patients with gestational trophoblastic disease and some normal pregnancies. There is even one baby, but maybe the woman has any pathology that is making human chorionic gonadotropin levels actually get high. So management is normally is due to pregnancy. So 2 to 4 months after maybe you remove the issue. If it is a molar pregnancy, okay, that's like a false pregnancy. 2 to 4 months after you remove it, it should go. All right. Then normal pregnancies, after the woman has given birth, it should go. Then for any complications that will come up, all right, you can just do surgeries. Maybe if it's bleeding, just try to stop the bleeding. All right, tissues are dying, just try to stop it and all of that. Okay, so that's just what the hyperreactio luteinalis simply means. Okay, the ovaries are hyperreacting to what? High levels of human chorionic gonadotropin.